Yeah, presenters. Let us start because we would like to keep time. We'd like to utilize this 1 hour, maybe an extra 10 or 20 minutes to start off this meeting. We are very grateful that World Federation Against Drug Abuse accepted to organize, accepted to participate in this webinar, where some critical information emerged from the C&D Commission on Narcotic Drugs, and also a lot of presentations were made. So we felt obliged that we need to keep our colleagues, our people, our friends informed about what is happening, but also an appeal to you that you pick interest in what is happening at the Commission Against Narcotic Drugs, so that we are up to date, we are informed, we learn. But also the second point I would like to make here is that we need early warnings, especially in Africa. We need to know what is happening somewhere else. We need to know what is happening in Europe, in America, in Asia. Early warning helps us to plan early, but also to strategize and be able to treat. So last year, but as you know, in Africa, we need each brothers. Brothers keeper, we are brothers keeper. Anything which affects your brother also affects you. So I'm very grateful that you have accepted to come. Allow me to extend my sincere thanks. Sincere thanks to WFAD, sincere thanks to ISSUP, sincere thanks to my younger brother, George, George in Nairobi. Thank you so much. Thank you so much for moving the African Union platform where I'll be sharing a lot of information. But also to my other brothers, colleagues, wherever you are. Thank you so much for turning up. We hope we learn a lot about insights into synthetic drug trends, essential knowledge for civil society organization in Africa. I'll be moderating. My name's Rogers Kasirye. I'm the Vice President. Without wasting much time, I'll be inviting Mrs. Emmy Lobson, the Drug Free America Foundation, to make a brief presentation, which will be supplemented or complemented by Cressida DeWitt from World Federation Against Drugs. So take over the floor. Emmy, please. Thank you.
Wonderful. Thank you, Rogers. I'm so happy to be here with you guys today, and I'm going to share my screen. And as Rogers said, I am going to do a short, short for me, presentation on, I can't talk and do two things at once. Hold on one second. On synthetics, and kind of look at some practices that we've had here in the US, and just give you kind of a overview on what has been happening in the US around synthetic drugs. So this data is a little bit dated because we were looking at different types of death. So this is probably a year or maybe a little bit older, but it still stands true that drug poisonings are the leading killer of Americans between 18 and 45. And just to put that in perspective for you, you can see our drug poisonings lined up with suicides, deaths from firearms, and deaths from car crashes in the US. So each one of these little people on the column represents 500 lives. And again, this information is from 2022. So these numbers are a little bit higher now, unfortunately, but still stands true that it is the leading cause of death between Americans 18 to 45, which is very frightening. In the US, we have a few different illicit synthetic drugs that are leading this toll, the first of which is fentanyl and different fentanyl analogs, but we also have methamphetamines, synthetic cannabinoids, and MDMA analogs. But for purposes of this short presentation, we're just going to concentrate on the fentanyls. But all of these drugs pose significant health and safety risks because they're more pure and more potent than any other time in the history of drugs being produced around the globe. A lot of them are produced with toxic additives. So a lot of times when we talk about overdoses, it's not because of the specific drug, it's because of the adulterants that are added to those drugs. And if any of you ever have the opportunity to listen to Tom Brown from the Colombo Plan, he does an amazing presentation on the topic of the adulterants that are added to these drugs. There is, we say here, a lack of quality control, but there really isn't any kind of control because these aren't synthesized in legitimate labs. These are done in clandestine labs across the globe. And that makes the contamination risks substantially higher. And we can see a lot of other things inside these drugs besides the drugs themselves and the adulterants. So I got this information from the DEA here in the United States, and they report a dramatic rise in the number of fake pills. So in the US, we have people buying what they think are Oxycontins or Xanax or Tramadols or Adderalls on the street, and they look just like those other drugs, but they are fake pills and they have lethal doses of fentanyl. So according to the DEA, when they look at the drugs that they're taking off the streets, 7 out of 10 pills that they test have fentanyl, a potentially lethal dose of fentanyl in them. So even when people aren't seeking fentanyl on the streets, they are getting fentanyl, whether they know it or not, which has caused the dramatic overdose deaths in the US. So this is also something I got from the US Drug Enforcement Administration, and it shows the global reach and influence of the cartels in Mexico, who this is where we get most of our illicitly produced fentanyl and fentanyl analogs from. And I, of course, naturally assumed they were coming into North and South America, but as you can see, they have a significant reach across the globe. So you see the red is the Sinaloa cartel, the green is the Jalisco cartel, and you can see where they're going at around the globe. And then if you look at the United States, these are the different fentanyl seizures by the Drug Enforcement Administration. So you can see where these small territories in Mexico are infiltrating across the border and coming into almost every single state there is. And then these are where the fentanyl has been seized. So you can see the great reach of these cartels. But it's not just fentanyl. Now we have xylazine. Xylazine is a potent animal tranquilizer, large animal tranquilizer. It has no use for humans, very powerful, and has been causing many deaths. And you can see from this picture here, the DEA labs have determined where these xylazine adulterated fentanyl tablets are coming from. My state of Florida there is in the bottom right-hand corner, and you can see it is a darker blue. And unfortunately, that means that we are seeing more of the xylazine and fentanyl in our state. So that just kind of gives you an overview of what's happening. So the illicit use of fentanyl leads to serious health problems. The most serious, obviously, is overdose and death, but it causes respiratory depression, comas, obviously addiction, mental health issues, and issues with infectious disease by the way in which the fentanyl is used. It has a tremendous impact to families. Families experience many problems that are associated with substance use disorders, and especially the opioid use disorders. And that could be the financial strain because the family member is spending the family's income trying to get these substances, the emotional stress, because as we know, when somebody's using these substances, they're not 100% there for their family or for themselves, relationship problems, and a lot of child neglect or abuse. It also causes economic and social strains on the community, the state, and the country at large. It's a huge burden on our healthcare system. When you think of all the overdoses that we're treating, the long-term healthcare issues that are associated with those issues, a huge strain on the criminal justice system when we look at law enforcement, the courts, incarcerations. So even though we are supporting alternatives to incarceration and we want people to get the treatment that they need instead of being locked away, that also costs a substantial amount of money. And then there's the community disruption. When we look at the impact of drug use on our communities, and we see the impact on crime, the impact on our families, and how it undermines the social fabric affected in those different areas, we see a tremendous economic and social cost. Of course, there are also enforcement challenges. These drugs change on a daily basis. Every day there's something new with these synthetic drugs. New things are constantly emerging, and that makes it very difficult for law enforcement to detect the drugs and to seize the drugs. The supply chain is hard to disrupt because these labs can be moved very quickly. They're very adept at setting up and tearing down very quickly. And then also, it's just, you're constantly figuring out how to disrupt the innovative ways and combat the innovation that drug traffickers are leveraging when it comes to our technology, when we're looking at the dark web, when we're looking at the supply chains on how they go about getting this through. So there are many enforcement challenges as well. All of this is going to take international cooperation. And I think that we saw a lot of this at CND this year. We saw the emergence of and I'm probably saying the name of this wrong, but the Global Task Force to Combat Synthetic Drugs. And I believe when we were at CND, they had almost 40 countries signed on to this, pledging to work together to stop the global infiltration of these synthetic drugs. And I think more have signed on since then. So that's going to take legal reform, information sharing between different countries and across the globe. We're going to have some substantial financial input from different countries, the countries that can afford to do so, to fund the initiatives to help shut all this down. And then, of course, it takes the global coordination that we're seeing through that task force. There are a lot of different areas of action. I'm going to concentrate on a few of them, and then I'm going to close out. But one of them is education and awareness. So in my country here in the US, we have One Pill Can Kill. It's a program through the DEA. You can go to their website and download some resources from them. And it has a lot of information, one-pagers, and things that you can share on social media and use within your community. And then another one is called The Real Deal on Fentanyl. And it shows you everything that's happening around this issue in the US and provides all different resources to engage the community in these efforts. Some of the things that we've done are take back programs where you're taking your unused medication and disposing of them safely, teaching about prescription drug safety so that our youth know not to use other people's prescriptions and only things that are prescribed to them by a doctor, making sure that the overdose reversal medications are available. That's naloxone. And then hosting town hall meetings, and this picture that you see is of a vigil. So this was actually in my community here, and all of these pictures are people that were lost that year to a drug overdose, and people bring the pictures, and we just have a moment where we talk about them and we acknowledge them, and we work with the families and be there for the families, and so that they know that this is something that it's a community loss, it's not an individual loss. When it comes to treatment rehabilitation, we've got detox programs, counseling programs, behavioral health therapies, and support groups. These are all things that are needed. There's even some harm reduction strategies that can be very useful when it comes to addressing the opioid epidemic and the synthetic drugs. The first of those is overdose prevention, making sure that the Narcan has increased availability outside of just our first responders, but that others have access to it as well. But having access also means that the community needs to be aware of where to get it, when to get it, and how to use it. So there needs to be training. And of course, this needs to be followed up with screenings and brief interventions and referrals to treatment. We can't just have this as a standalone strategy. Also, we have been using fentanyl testing strips in the US. They're legally available now. The data is not out yet on how effective these will be in reducing overdose or referring people into treatment. But the concept is that if you have a substance and you are a current drug user, you would use these testing strips to see if you're supply had any fentanyl in it, so that you're making more of an informed choice. Because on sometimes, let's say people are going to use cocaine, they might want to test their cocaine to make sure that fentanyl is not in it. Again, this is a new strategy. We don't have a lot of data or research on it, so only time will tell if this is effective or not. But again, all of these harm reduction strategies have to be paired with screenings, brief interventions, and referrals to treatment, because the goal here is to use these strategies within a continuum of care so that people are getting the help that they need and can be part of a sustained recovery. Early intervention programs, making sure that we're building protective factors, reducing risk factors, and building resilience, which I know that this is something that almost all of you are doing within the wonderful programs that you're doing within your community. And lastly is just a call to action. This is going to take a global effort. It's not something that any one of our organizations can do on our own. It has to involve a multifaceted approach, including law enforcement, public health, community engagement of civil society, and only through our coordinated efforts, just like everything else that we work on jointly, is when we're going to be able to safeguard our neighborhoods from the devastating impacts of these different dangerous substances. And with that, I will make sure that you have these slides available to you so that you can have them to review later on when you have more time. And I will stop sharing my screen, and I believe Rogers will then give the floor to Cressida.
Thank you so much, Emmy. Actually, what you are doing, you are giving us a lot of information. And there is a saying here that forewarned is forearmed. Thank you so much for taking time to give us these statistics. Some of the information may look strange to us, but I think we need to get the information. We need to know the early warnings. And now I want to invite Cressida. Cressida, how is the situation in Europe? What can you help us to understand as people who are seeing this problem? Over to you, Cressida, please.
Thank you so much for the introduction. And thank you also, Amy, for sharing such a comprehensive presentation. It was really showcasing everything from the impact of synthetic drugs and also some best practice examples. And I think we can all learn from that. I was asked to shed a light on the European case as well as the African case. And since these are two very big cases, I just can briefly go into both of them. But I'll try my best, of course. So looking at the African case, similar to the global trend, it has been accelerated, the synthetic drugs. So the continent has seen an increase of synthetic drugs. And as seen in the graph on this slide, is that synthetic drugs is the highest in North Africa, followed by West Africa. And recently also Southern Africa has surpassed the global average on synthetic drug trade. And tramadol is the regional dominant synthetic drug in North and West Africa. However, other synthetic drugs are on the rise. And as Amy mentioned, many of them are very new to the market and are very much undiscovered as well. Beside an increase in illegal drug trafficking and its related crime, the African continent is also confronted by the rapidly rising consumption of synthetic drugs. And therefore, the African Union recently joined the global coalition to address the challenges caused by synthetic drug trafficking and use throughout the world, which is led by the USA, WHO, and the UNODC. They joined in 2023. And this coalition aims to accelerate efforts against synthetic drugs and employ prevention approaches. However, member states are responsible and have the authority to respond rather than African Union itself. A report by ECOWAS in February 2024 highlighted that whereas their national responses to increasing proliferation are needed, many countries fail to recognize or acknowledge the diversity of synthetic substances available within the border. And it shares in the report, and I quote, "While some have little to no capacity to detect them, others are simply reluctant to invest in such surveillance at the cost of diverting limited financial resources from other critical tasks." Another important issue is the fact that the African drug market is vastly under-researched as a whole, especially synthetic drugs. And currently there is no reliable way to determine some of the basic marketplace dominators necessary to assess a drug market environment. And the available data mainly originates from drug seizures, and even though these are great in understanding and monitoring and measure law enforcement presence and ability, they are not a good foundation to build information on markets or flows more generally. And on top of that, the rate of reported law enforcement detection is rather low due to underreporting and a lack of detection capacity. And this has a fast impact on the ability to develop appropriate targeted responses and assess the local drug market environments. Looking at the European case, Europe has a long history of producing and consuming synthetic drugs. The production of the substances is for both the domestic market as well as the global market. And with the dominant market being MDMA, amphetamine and methamphetamine, and the production is on the rise at the same time. Other emerge of new psychosubstance use substances are also on the rise. And similar to the global challenges, the continuous innovation of the drug market, the increased availability and the number of substances, often very high in potency or purity, are key challenges to the European Union. And the EMCDA shared that by the end of 2022, 930 new psychoactive substances were monitored, out of which 41 were first reported in Europe in 2022. Generally, the EU in the responsibility of drug regulation and legislation is mainly on national level, and it is defined in national drug policies rooted in their respective histories and legal traditions. The EU does not have a drug strategy in place, and the most recent one is running between 2021 and 2025. And to be responsive and proactive towards the dynamic and complex synthetic drug market and its growth, particularly new psychoactive substances, the European Union introduced the EU Early Warning System in 1997 to collect information and target new and unexpected areas. Since it has been strengthened in 2005 and is operating as a regulation since 2018. And as you can see on the slide, the EWS, the Early Warning System, is a three-step legal framework designed to support the European Union to rapidly detect, assess, and respond to health and social threats caused by new psychoactive substances. And the EWS strengthens the provision for early warning, makes the procedure for the initial report and risk assessment more efficient, and substantially shortens the timeline for all stages of the procedure. The early warning system is operated by the EMCDA and Europol in collaboration with the 29 national early warning systems across Europe, the European Medicines Agency, and the European Commission. The EMCDA, in cooperation with the Europol, is responsible for collecting, collating, analyzing, assessing, and communicating the information reported by the network to provide them with any information required for the purposes of early warning and draw up an initial report with the health of social risks of one of several similar NPS. The early warning system gathers information from national and early warning systems and information on chemical identification of new psychoactive substances from forensic and toxicology laboratories. And the laboratories built the cases from NPS seizures by law enforcement agencies, from poisoning, such as hospitals, and from samples collected from people who use NPS and from test purchases. And reflecting on the last 25 years, the EMCDA shared a report in which they highlighted various learned lessons and needs, including the effectiveness as well as further need for the investment in the early warning system, the response planning, importance of collaboration among partners, need for effective mechanisms to report, collect, analyze, and share reports. And one learned lesson I would like to finalize the presentation with, since I think it's a general message for all, is that the rapid action might be needed, but in the real world, timely responses often need to be based on partial and incomplete data, meaning evaluation and regular review of the impact of responses is also required. So the real world is often moving faster than the data that can be collected at the same time. So decisions have to be made very fast with a little bit of data available, but yet they need to be taken. So thank you so much. I hope you had a bit of an overview inside of the African and European case.
Thank you so much, Cressida. This is very important because the map in Africa which you have showed us that actually people are using synthetic drugs is very unique. For example, in East Africa, we don't see people using this, maybe partly because we may not be aware of the problem. And like you told us, and Amy, that you don't need a big factory to start producing these synthetic drugs. But also when you are children, when young people are using, how do we tell that these are synthetic drugs? And they have very high negative consequences. Now, I'm going to invite Muruka. Muruka, please, can you join and share with us about issues of recovery? And remember, I want to invite also Regina, and then I'll open the house for discussion so that we can hear from our colleagues. Thank you very much, Cressida, Amy. Now, Muruka, please go ahead.
Thank you so much, Rogers, and so lovely to have this presentation with all of you. And I'm sorry I will not be able to talk this fast like Cressida and Amy. This is not my native language, so pardon, and warn me when my time is by the end. So I'm going to share my presentation, and hopefully you see it now. Can you see it?
Yeah, it comes out.
Perfect. Thank you so much. So from all of these data now back to the community and recovery. And so before I start with comparing also recovery with prevention and presenting some of our latest initiatives, I wanted to, just for the sake of a wider audience, speak a little bit about recovery. And we always show this slide in our conferences just to show what recovery is and what are the statistics of recovery. So there has not been a consensus in terms of meaning of recovery from addiction, but as you can see on the slide, it kind of covers control over the substance, which can be problematic use and addiction, maximizing health and well-being, and also participating in the rights and roles in the society and community. And what everybody agrees on around recovery from addiction is that it is a process over time, and there is no one path to recovery for everybody. And it requires lots of connections with the local community, aspirations and hope to achieve recovery, and also building on the positive benefits of recovery capital, which are resources available to the local community. So this model is quite adjustable to the local resources and local needs of the people. And some of the rates of recovery are very surprising when we present this data, but actually 58% of people who seek recovery do eventually recover. And this is really encouraging in terms of otherwise really negative opinions that recovery is not possible, that people should be provided drugs or harm reductions approaches exclusively, but this is not the case. And we do have these rates of relapse, and among the general populations, they are 40%. And for people who just left detox and are in a period of time of first year in recovery, which is called early recovery, these risks are very high and they reach 70%. But when people reach 5 years in stable remission, this kind of drops to 40%, likewise in the general population. And this is the case for each and every chronic relapsing disorder or a condition like cancer or anything else. So after 5 years of stable remission, people who have been severely addicted really have a better chance of maintaining recovery. But there are some really negative kind of data on addiction. It probably lasts around 25 to 28 years, and people usually have 4 to 5 episodes of treatment over the last kind of 8 years of the drug use and addiction. And also the reasons for stopping addiction and staying kind of in the stable remissions are not the same. And I will now not talk about it, but can provide the data for people who are working in this field. So I was criticized that I don't put much text into my presentation. So I have provided a couple of bullet points to go with what I'm saying. And my task today is kind of to link prevention and recovery and unite the prevention and recovery kind of pillars of demand reduction. And as you can see on this slide, so the assumption of this model of merging prevention and also a recovery is that for many people who end up addicted, there have been significant and challenges, typically involving the lack of protective factors and the abundance of the risk factors. And as you can see, this is also kind of very compatible with pro-recovery culture and negative recovery culture on this slide. And the person who ends up addicted will often have struggled to reach recovery, reestablish normal sober life, and only a fortunate few will have early interventions and significant positive events that may act as push factors or protective factors, and also help them to kind of stop this problematic drug use and not drag them into addiction. So trouble with the treatment interventions, as we know, is that they primarily kind of are anchored to symptoms and kind of to symptom reduction services. And this only temporarily helped the individual to stable long-term recovery. And when these complex life issues like lack of meaningful activities, sense of purpose, lack of housing, family environment, which is not good, or social isolation or networks that use drugs occur. So this kind of helps the restatement of substance use and addiction and result into kind of persons sinking back to the bottom and dragging a person back to the drug addiction. And the other problem around this is that assessment of drug and alcohol treatment, they're generally, I would say, very miserable affairs for both parties, and results really worry us about risk, safety, funding, everything that probably all of you have experienced. And this goes back kind of as a domino effect to a person who kind of loses involvement in the family, has reoccurring traumatic experiences, and the person is back to where they have been. And the treatment service, what it does is kind of push the person to lay all the cards on the table, the bad cards, to help them deal a better hand, I would say, in kind of that analogy. And the person seeks help, is encouraged to open and be honest about, you know, all of the bad things in their lives. But actually, current drug use or inner trauma or everything pushes the person even more into the pathologies that have been kind of dominating the treatment services. And all of this has pushed us from the recovery services to think in a different way and to think in a strength-based way. So to fundamentally transition from a pathology-based to this kind of recovery and strength-based models, we need to kind of provide new treatment outreach and to help individuals build those kind of protective factors or pro-recovery culture. And this is really something that has been proved in the literature, and the community-based services and the notions of being better than well in recovery are fundamental goals of of this system. And most simply framed, this model is actually supporting people to achieve somewhere to live, someone to love and belong to, and social network and meaningful activities to be a golden thread that run in the recovery literature, but also we see that on the ground. And how we can change it is by measuring not only deficit, but also strengths, and actually doing something in the community, because detoxes and clinics, they last really shortly, and we cannot expect people to recover if the treatment and recovery is very short. And we need to build the relationship with the person who is addicted, because expert-patient relationship often kind of presents a big challenge to people who have been severely addicted. And what this means into practice is actually, like with young people and prevention, to ask them what is strong about them and not what is wrong about them. And this is also linked into the peer recovery experiences, role modeling, social learning, but all of those things that are very important in prevention, they are as well important in recovery. So this has made us thinking, what are the implications of these kind of recovery researches for our future work? And I will not go into many details, and I think lots of you know about the notion of CHIME. And this is kind of ethical recovery research approach, but also service approach, and to create positive connections, relationship, generate hope that participation or treatment is possible, or recovery is possible, and for people to generate new identities which are not substance using or drug using, and also provide meaning to people that will then feel empowered by this process. So what we have done in terms of the change of the policy and influencing the policy, I am also Secretary General of this network, which is called Recovered Users Network. And it's a platform of people in recovery, those supporting them, families and communities, to kind of provide the voices of recovery into the policy and into the practice. And this was really important for us. I come from a really marginalized and stigmatized area of Europe, Bosnia, and we were, post-war country, and there has been no mention of recovery. So it was really unsuccessful kind of influences of prevention as well, strong influence of harm reduction in the past area, and not the really evidence-based one. So we decided to unite all the voices of prevention, early intervention, recovery, treatment, and drug policy, and to produce something that's called Global Position Paper on Recovery. And pardon to those who have heard me speak before about this, but we decided that this is something really important, that we need to engage the researchers, member states. We need to provide this kind of united voice, because there has been many dichotomies in recovery and treatment field as well. But there is no one way better than the other for a person. So we met as a global network, and we decided for this to be kind of a cohesive approach, uniting the voices, raising awareness in global, international, UN, and also national levels. And I hope that we had a great response from Africa, and I will show that in my presentation, but I hope that also Africa can join this kind of global initiative that really promotes all of these positive and strength-based approaches to drug demand reduction. And we committed to working together in one platform. And
Moluka, you have 2 minutes to go.
Oh, okay. I will just say this was a collaborative process, and I will share this presentation, and I hope that lots of you can join us. And we did this dissemination of the link. You have it in this QR code. And we created a global consensus on recovery, conceptualizing 3 pillars: strength, barriers, and systems, and also providing recommendations. So what I can tell you from the strengths is, all of you know that we need to support people. We need to address the continuum of care, which is really needed, and improve the stable recovery outcomes and possibilities for people to lead drug-free lives. And as we all know, stigma and discriminalization need to be addressed, and treatment support need to be much better, but also education, training, and awareness need to increase. And in terms of systems, we generated that partnership models are much better, that we need more funding, evidence-based also, and integrating recovery across demand reduction. And I think this is a key point for us. And we had generated 10 recommendations, but what I want to highlight is that this was not written only by me. This was a collaborative process, and more than 50 large networks contributed to these voices. So this is also their voice. It's not only one person writing these kind of paper and then everybody signing it. This was something that was done with the communities, with professionals, and for people in recovery and with people in recovery. And so far we have the global endorsement around 800 signatures. These numbers on the map are not now the same. This was the breakdown on the 29th of February, but we had a really good response so far from Africa, and I think this will probably just increase. And just wanted you to know that we engaged all of the governments. We presented all of this during the CND. We have been since invited to sit with EMCDDA, ISSUP, UNODC, do lots and lots of podcasts and global ideas and opportunities. So just a couple of questions maybe for discussions and considerations, but thank you so much. And I'm gonna finish with that.
Okay. Thank you so much, Moruka, for that elaborate. It appears as if in the future we are going to make an arrangement for you to give a more detailed explanation on recovery. Because one of our major problems we have here in Africa is how to address recovery and also how to integrate prevention and recovery. I know people will be asking a few questions. I'm going to ask our Secretary General, Regina Matson, to share briefly with us what happened at CND. I'll give you 6, 7, 8 minutes, and then we'll ask our colleagues to ask a few questions. But I've asked them to type their emails that we want you to send. We want you to send them the presentation, the slides. I will encourage many of you to type your emails, but also I'll also ask Christina to type her email so that you can send and people will be willing to share with you. Over to you, Regina, please.
Thank you so much, Rogers. And let's see if I also have sometimes some trouble to share as I am not able to do two things at the same time when it comes to technology. All right, thank you so much, Rogers, and thank you to everybody for being here. It's a great possibility for us to share such a wide range of the spectrum to showcase the work when it comes to synthetic drugs, the work when it comes to prevention and recovery. And now I have the opportunity to give just a few slides, information about some slides for the CND. And to begin, I wasn't, not everybody is aware of the CND, right? This is short for the Commission on Narcotic Drugs. And the CND was actually established to assist another UN body in supervising the application of the International Drug Control Treaty. So how can we support member states to implement the drug control treaties that they have signed? And the CND functions as the governing body also of the United Nations Office on Drugs and Crime. So this is the highest instance in which the treaties are covered, resolutions, but also the whole office of the UNODC is governed by this CND. And the CND meets regularly, annually, but also during intersessionals throughout the years, and they adopt a wide range of decisions and resolutions. So in this year, it's actually was a midterm review, because back in 2019, the Commission adopted something called the Ministerial Declaration on Strengthening Actions. And this was a joint commitment to address and counter the world drug problem. And they made a series of initiatives and had planned to come back to this in a progress report with a midterm review this year of 2024. So this means that this year was quite a special segment, so to speak. The way that civil society can engage is that civil society with ECOSOC status, so you go through a process in which you apply for membership. Once you have been granted that, you're able to contribute actively during the CND. So you can attend most of the sessions, you can offer exhibitions throughout this week, you can do statements and side events, and each of the organizations that have an ECOSOC status can bring 10 people. So even though your organization yourself might not have the status, WFAD, for example, does. So we can bring people under our umbrella, so to speak, to attend the sessions. And this year's session was divided in two. It started with a high-level session that covered this midterm review of the ministerial declaration, and that was between the 14th and 15th of March, so it was a Thursday and Friday, and there was a lot of presidents and prime ministers and, you know, high-level ministers taking part in this session in Vienna, where the CND is usually held. And that was followed by the regular session. And I provided a photo here because this year, actually, both the executive director of United Nations Office on Drugs and Crime, Ms. Gadawali, who is here on the left, she's from Egypt. And the CND chair this year is Honorable Philbert Johnson of Ghana. So we had two representatives in the highest position from the continent of Africa, which was great. And they led the session fantastically. This is more or less a meeting point, not only for member states and representatives of intergovernmental organizations. As you can see, there were 140 member states present this year, 18 intergovernmental organizations, 9 United Nations entities, and 141 non-governmental organizations. So we as civil society really took a big part of this year's sessions. I should say as well, before I mention the civil society engagement, that this year what is taking place from the member state side is that they identified and placed 23 new substances under international control. They adopted 4 resolutions, which cover the topics of alternative development, rehabilitation and recovery management programs, improving access to and availability of controlled substances for medical purposes, and one on preventing and responding to overdose. Overall, it was a huge success from the side of civil society engagement. Like I said, there was 141 NGOs present at this time. And there was a record number of side events. So side events are about 50-minute long seminars that you can have in person, online, or in a hybrid format. And this year, there were 162 side events during 1 week of the regular sessions. So you can imagine it was a lot of activities going on. But we did have a look from WFAD and our networks and our partner side. We could see that we were featured in 36 side events out of these side events, and approximately 65% were drug demand and supply reduction related. So it was a great success. And this year as well, we were able to have a very evident youth engagement, not only from the United Nations side, where they had their youth network, but also from our side, from the network of WFAD and our colleagues, because thanks to our president, Amy, we were able to bring youth representation as well to engage during the week. I wanted to show a bit about what we did. Here are some of the exhibitions, or 2 of the exhibitions that we had the honor to have, and we had these together with Fourth Wave Foundation, as you can see here on one side, as well as Drug Free America Foundation, and a lot of other global networks, including Celebrate Recovery. You can see Mocha and Cressida there in the middle in one of the great exhibitions. To the side there, so why I engage, as you can see with the photos of the many young people. This was an exhibition that we titled Children Matter, Right to a Drug-Free Childhood, and the Importance of Youth Engagement. So here we were striving to highlight the silent majority. So all these young people that are choosing not to engage in illicit drug use, and, you know, showcasing their right to a healthy childhood and socially responsible youth. and that they have the right to really thrive in a healthy and sustainable environment. And this was actually put together by a youth network called SOY. You can see on, let's see, my right, a photo of two of the young people as well there in one of the exhibitions. And in the middle where Cressida and Mulka are is the exhibition called We Are All in This Together, which was about uniting the voices of drug demand reduction. So this exhibition was really a result of global networks and grassroots organizations who came together and uniting passionate advocates and experts and peers, showcasing that we have a joint message. So the way that we tackle this global world problem is that we're all in this together, and we're providing and offering alternatives for a continuum of care, starting with prevention, offering evidence-based harm reduction, securing treatment, recovery, and reintegration. And by doing so, focusing also on those population groups that are most vulnerable to these problems. WFAD also had the opportunity to host and co-host 11 side events, and here are some of the names. On our website, we'll send this out later. You can watch some of these recordings as well online. But I wanted to say as well that this year we were very grateful for such high-level commitment in many of our side events. We co-organized a side event from WFAD side, for example, together with the United States and the United Nations Office on Drugs and Crime. And I know for Roger's side event, there was high-level participation as well as co-hosting some of these with governments and UN bodies. One highlight was the launch of the Declaration of Oviedo. Now, Mulka mentioned brilliantly the declaration on the Global Position Paper on Recovery, which is a huge global initiative about recovery. We also launched an initiative on prevention and the importance of coming together across the globe with 10 proposals on how to strengthen prevention, invest in prevention, and ensure that prevention is on the top of the agenda as well. So we had a huge launch for that event, and I'll share the link as well in the chats. Here you can see our fantastic panel of youth representatives in one of our side events. And I've added a bunch of different photos now just to showcase the different topics, the different people, and all of these great events. You can see it's quite a difference sometimes with the rooms. And here we had a hybrid with our fantastic East Africa network and some other nice photos. This is outside the UN building. In addition to this, we hosted together with Drug Free America Foundation and the African Union an important luncheon, and this was focusing on the global marijuana policy landscape and its impact on the normalization of marijuana use among youth and the impacts that these policies have on countries. So we had a great panel with Amy, our president, who gave us the reality check that we need to see what's happening in the US. We had a colleague from URAD who provided an overview of what's going on here in Europe. We had Dr. Yvonne Orlando from NACADA, who gave us a picture of the impact in Kenya, but also Africa at a broader scale. And then we had Edna Joseph from SOY, who is a youth delegate, talking about how the marijuana cannabis industry is marketing towards youth. And we tried to give examples on how to counteract this. And we had participants there from different member states of the African Union, as well as some representatives from the UN and some reps from some countries in Europe and Asia and Oceania, which were great because we really wanted to give them a showcase of what are the risks involved in legalizing marijuana and why we need to stop this process. Our fantastic Vice President Rogers also partook in a special meeting with United Nations of Office on Drugs and Crimes Executive Director, Ms. Gada Wali, which was a huge success. This is one of the first times that she has met with civil society, and they provided this declaration of Oviedo showcasing the importance of prevention. And I know Rogers can probably answer a lot about that meeting and his contributions to that. And finally, there was a launch of an African Union Civil Society Forum. So this is an idea from the African Union to engage African civil society better within the framework of the African Union, but also towards the CND. And I hope that we can hear a bit about this as well. And as soon as this has more, there's a mapping being done now to see which map the civil society on the African continent. And the next step after that, I believe, will be a more formal initiation. And we hope to be able to share some news on this as well. So finally, the CND is really a great place to engage on a global arena, and it's a great opportunity for civil society to showcase the realities. I think Cressida mentioned that data isn't always so reliable because things are happening very fast in reality. And it's the same with policies. Policies are made in these big rooms and oftentimes lack or miss the reality of the grassroots organizations, and the reality of people on the ground. So this is an important arena in which we can work together to make sure that our voices are heard on these international arenas. So there are endless possibilities when we join hands, and I hope that in the future we can engage many more of you. So thank you, and I'll hand back over to Rogers, and I hope you have some questions for us.
Okay, thank you so much, Regina. Very elaborate, very insightful and informative of what happens in Vienna. Because this is for the first time we are hearing somebody sharing the experience on what happens at the United Nations Office on Drug and Crime, particularly the CND Convention on Narcotic Drugs, which is the highest supreme body in making that decision. Thank you so much. People have sent their emails. They're expecting you to share the presentations later, and I think WFAD can take on this. Many of them have tapped their emails. If you haven't, please. We want to use the remaining 10 minutes to ask you, colleagues, to ask questions or to make comments and observations. Please, I now ask Cressida to open up so that people can share and let us know what are they feeling and experiencing. Thank you very much.
Thank you, Rogers. I see that Odalo George has a question. Would you like to share that live? You should be able to unmute yourself.
Georgia may want to make a comment because Georgia has been very inspirational as far as the African Civil Society Forum is concerned. Is the pioneer of that effort. Georgia, go ahead, please.
Yes. First of all, thank you very much for the opportunity. I don't know. I think I got disconnected at some point, but I have a few questions that I wanted to ask or put across. One is based on the presentation that Amy presented on areas of intervention, or where there is need for call for action, because we do a lot of education and awareness. How can we become part and parcel of what she's doing? And also the community engagement. I know we can do a few things here and there just to ensure that we lobby and ensure much is done. Then the other question was about the second presentation about early warning by EU. I wanted to know how can we learn the best lessons so that we can share this with also African Union to see how this can be of help to our continent. Then the third question was about data. There was a presentation about research and all that. How can we work together with other civil society to ensure that we produce up-to-date data, because Africa remains behind because of issues related to data. Then finally is about the AU engagement. It's a process that we've started, and we are slowly working towards the goalpost. So I know we'll be able to get the best out of it. So, and thank you, Regina, for highlighting on this. So that is all I have from my end.
Thank you, George, and thank you for being here with us. I'm very happy to see you online. Sorry, Rogers, I was just very keen to see him.
I'm going to request that we get the 3-4 questions together. Then we will be able to, you people will be able to answer, and we can wrap it up. Anyone with a question, you can even type the question in the chat box.
I see Maria has her hand raised.
Hey, Maria, go ahead, please.
Thank you so much. I really want to appreciate the convener of this meeting for giving us a feel of the actual meeting that took place in March, I believe. I think this is the first time I'm getting to see what really goes on, or what had gone down at that period in time, and I'm most grateful. I'm particularly interested in the African Union CSO, and I would like to know how to be a part of that. And then even the WFAD and the whole CND thing, because I don't seem to know how to get to that. Thank you so much.
Okay, now I see. Oh, can you get the extra two people to make their questions? And then I'll ask my presenters to respond back. I see somebody called Joanne. Joanne has raised a question in the chat. And she's saying, how will the forum ensure that it is recommendation and best practices with policymakers and practitioners across Africa? Okay, that's a good question. I see Anne Huria says, thank you so much for the presentation and on synthetic drugs. And given that they are growing in East Africa and Africa, there's an urgent need for capacity building and research to prepare us to have a meaningful engagement and make more relevant reports. Dorothy Musimbi is saying, please, is it possible to get a recording? I can say yes, because we have been recording, we will share with you. I want you to get the address of WFAD. I think I'm going to ask Cressida to type it down here. In case you don't get, you can send. Okay, one more question.
I see Brian has a question. He has his
please,
hand
Brian,
up.
go ahead. Yeah, the WFAD message has been passed. Go ahead, please.
Thank you, Rogers. My name is Brian from Blue Cross Kenya. My question, thanks for the good presentation on the policies, on the CND. I'll echo what others have said. It's good to know much that took place at the CND. So my question goes on issues of, apart from the policy makers, how can, I see this group and with George, we're working on the issue of alcohol policy. How can the organizations in Africa
Hey, my brother, you disappeared. Where are you? Network problem. I know that
network problem in Africa.
Yes, I know, but there was a question on African Union. Georgia, don't disappear. African civil society.
I'm here.
Okay, wait, I'll ask you in this order. Amy, do you have a comment to make as we wrap up?
I can speak on behalf of Amy. She had to log out, of, unfortunately. But George, thank you. That was a great question concerning synthetic drugs and the work that they're doing on a global level as well as the US. I'm sure that there are different ways to get involved with Drug Free America Foundation. And they can share, I'll ask her to share some links, not only to the work that they're doing, but also on how to get involved in this global coalition that she mentioned that the INL is doing. So we will ask her to send something out with the question.
Regina, what about the question on policy? How the good practices, the policy issues, how are they going to trickle down?
Yes. So when it comes to the CND, that's the highest instance. So what happens with the CND is that there are overarching policies, and for some countries, some countries only have the International Drug Control Conventions as their drug policy in the country, and other countries have additional policies. So it's really up to each member state, but also civil society on how to implement these policies. And it can sometimes be hard, as we all are aware of this trickle-down effect. But that's where we come in as civil society, where we can hold our governments accountable to implement relevant policies. For example, when it comes to protecting children, the international drug conventions aren't very clear on that, but the Convention on the Rights of the Child very clearly states that governments need to protect and prevent children from the use, trafficking, and production of illicit drugs. So we as civil society can bank on our governments and hold them accountable to the promises that they've made in these policies. And how civil society can get involved in terms of C&D, well, you're most welcome to reach out to us at WFAD, because we try to, every year prior to the C&D, gather the voices of civil society so that we're heard on the international arena. So we do statements together, we do these side events, we try to write position papers, and we will do that also leading up to next year's C&D. So make sure to if you're not a member, you're most welcome to become a member. You can also sign up for our newsletter, and we'll send out everything to coordinate these efforts for the coming year. I hope that answered it. And I think that when it comes to the African Civil Society Forum, George will have more information, but I believe that the whole idea of this is to have a platform for civil society to engage with African Union. So it should be a forum where civil society voices are heard, but I'm sure that George can tell us more.
But also, you mentioned that you are encouraging the African civil society organizations to become members of ECOWAS, of the United Nations, because
yes.
in that they're officially registered, traveling and making arrangements to attend the C&D, they'll be allowed. If you are not a member of ECSOC, you cannot. You cannot go to C&D. You must be fully registered, you must be vetted in your country, and then they allow you to attend, because there are many people who attend. I think this time we reached like 1,500, 165 side events. Okay. So please promise to send them the presentation. But George, any comment on the African Civil Society Forum? George?
Yes. One, Regina has given a good background information, which is okay. We've done, the whole idea was to create a platform that is able to give us an avenue whereby we can engage with African Union and member states within the entire continent. And we've done our bit, the first part, which was to have the platform. The second part is mapping, which has been done. And if anyone is interested, they can say, chat me, then they can fill in the form. Then once that is done, then we are taking the process slowly, step by step, then see how we will be able to maneuver and get the things right so that we can start engaging with the African Union. So it's not something very complicated, but again, it is more or less like the way you do with the C&D. Here we try to create an avenue whereby we can even present a position paper or make a presentation during the side events and so on and so forth. Yeah, so that is it from my end.
Okay, as we wind up, Cressida, any comment?
I just wanted to add that the link for the mapping for the African Union Civil Society Unit, I have posted in a chat, so you can access it there. And I think there was also a question from George on the early warning system, how to learn from that. I think there are various reports on the early warning system. I mean, it's a very maybe big and complex institution by now because it has been operating for so many years, but they have recently shared an evaluation report of their 25 years. And I think that report is pretty good to read through to see what the European Union has learned from their operations and what they kind of recommend for future operations. Maybe that's a good starting point to start with regarding the early warning system.
Okay,
I have a question. May I ask?
Go ahead. Please go ahead.
I have a question. May I ask?
Go ahead.
Okay. Is there a way, thank you very much for the wonderful presentation. It is very, very informative. However, I'm asking, is there a way we can get the handouts and maybe the different channels, like one of our colleagues has asked, is there a way we can utilize social media to kind of help in the prevention strategies? And is there a way we can also get this information, or we can continue to attend more and more trainings of this sort, because this was something like an icebreaker. It is really too small. I've really liked the way you've presented. I've been looking at the slides. So if we can maybe organize more and more presentations of this sort, it will really be so nice. And I kindly request if you can also send us maybe some of the slides. You open up a file like for this training. Maybe we can say we have it quarterly or half a year or like that. Thank you. I submit over to you. I'm Mastula Mamugen.
You're muted, Rogers.
Thank you so much, Mastula. There are two webinars coming. There's a webinar which will come on children, adolescents, and prevention. That is slated for August, and maybe towards the November, end of November. We would like to do more again on recovery and have an in-depth discussion on recovery. How do we do recovery for our people? We are expected to invite experts both in Europe and also in Africa. We have got some good experts, but also what else we can do. We will let you know through these platform channels we have formed. But I want to encourage many of you to become members of WFAD, World Federation Against Drug Abuse. They believe that prevention is the answer. They believe that we can do a lot when we prevent drug use, but also they believe that we need to get information about drug use, and then we can make decisions. So drug use prevention, drug abuse recovery and treatment, all that will be coming up. As we wind up, Muluka, any comment? Because time is gone. Time is not on our side.
Yeah, no, just thank you, everybody. I know there was some kind of question about research, and we definitely do lots and lots of global researches. And the next two are coming around harm reduction, evidence-based harm reduction, and how prevention and recovery look at harm reduction. And we will send that information to you, Rogers, and people can participate. But we also started initiatives for families in recovery and the devastating kind of influence on families. This is not a one-person problem, it's a family problem and community problem as well. So we will just forward all of this to you, and please, whoever wants to get involved, by all means, contact us and we will let you know. Thank you so much.
Okay, thank you so much. Regina, before you go, Regina, I was expecting you to comment about the prevention forum, which is coming in July.
Yeah. Yes, thank you, Roger. So I mentioned briefly the Declaration of Oviedo, which is a global initiative on prevention. It has signatures of over 1,000, I think 300 organizations from across the globe. And it really is a mutual initiative. And through this initiative, we have hearings now. We just had one for the Americas, South and North America last week, and we will have a hearing for the African continent on the 2nd of July. So when we send you all of this information, we send you the recordings, we'll send you the PowerPoints, we will send you also the invitation to this hearing, and I hope you can all attend. It will be an important meeting for all of us, where we can talk more about these prevention strategies and hopefully social media and the questions that you've raised in the chat. And we'll send some links as well. So you raise a good question here about, you know, where can we find more information on certain topics? We'll share that as well in the send out. But schedule the 2nd of July. And let's see, what time did we say, Rogers? I think 11 East African time, but we'll send you everything. So just keep it in mind for now.
We'll send you through the platforms, and we'll be able to. Okay, we will be winding up. We'll be winding up.
Maybe Rogers. Yes, the platforms are there. But I also request if you can send on email, because sometimes on platform people delete information, but on email, it stays there. You can find it anytime. So like the links for the second training in July, and the information, it is better. It goes on in our respective emails. Thank you.
Okay. What we are going to do, we are going to capture all the emails you have sent us, collect them, and we send the information via email so that you can keep them, so that you don't delete them when your WhatsApps are so busy. We are very grateful for our colleagues who participated from South Africa, from West Africa, from East Africa, from our friends in North Africa, and many others. I know some were participating from Asia. Thank you so much. And WFAD, World Federation Against Drugs, plus African Civil Society Forum, we promise to bring you as many goods so that we can improve the way we do work. Thank you so much, Amy. Thank you so much, Regina. Thank you so much, Cressida and Muluka. All the presentations were made by ladies, and the chairperson was a gentleman. Thank you very much. And bye-bye. Thank you so much. Bye, please. Bye.
Thank you so